Since the start of the COVID-19 pandemic, numerous forms of stigma and discrimination have been reported. Some patients have shared that they became outcasts in their communities, while others have been publicly attacked. In other instances, stigmatization has reportedly resulted in Jamaicans resisting COVID-19 testing or avoiding visits to health centers after displaying symptoms. Due to the growing complaints, Chief Medical Officer of Health, Dr. Jacqueline Bisesa Mackenzie, is appealing to persons to desist from the act. She says the consequences can be broad.
Persons who have been tested have been told, don't bother, make it come back positive. So we are still facing that issue, and it is not allowing us to get a good handle of what is happening in some of these communities that we have gone into.
She explained that testing is in the best interest of all Jamaicans.
So when the public health team comes in, we should try to facilitate them as much as possible, because it is in your interest and in the interest of all the persons within that community for us to detect any cases quickly so that we can isolate those persons and be able to protect the rest of the community. So I want to encourage persons to cooperate and to come out for testing when we are in those communities.
Another area of concern is that persons have been going directly to laboratories to get tested for COVID-19 without involving a physician. She says this can hamper the health ministry's tabulation of COVID-19 test results.
So if persons are having signs or symptoms, then they should visit their doctor if those are not improving. And if they are required to do a test, there are certain things that the doctors will instruct them to do even before they get the test result if they are a suspected case. And I want to encourage persons to follow this process, because we are also having the situation that persons are getting back a positive test and choose not to report. And we need to have information if it is that we are going to be able to manage this public health emergency that we are in.
And Dr. Bisesa Mackenzie says both positive and negative results should be reported to the ministry. Kimberly Broderick, Frontline News.